Hi, you're watching West Bloomfield 911. I'm your host, Tim Shepard, and on behalf of Chief Michael Patton and Deputy Chief Kurt Lawson, and my brothers and sisters in blue, I would like to welcome you all to the show. Joining me today is Mega Szalony, Project Coordinator for the Oakland County Community Health Network. Megan, welcome to the show.
Thank you.
Thanks for taking the time out to come out and talk to me about a really important issue, I think, in the community. And so let's start out, and we're going to get in depth into what you do and where you work and what's going on in the community. And let's start with you. I know you're a social worker, correct?
Yes, that's correct.
Okay, now how did you get into social work and why did you decide on that as a career?
Well, it first starts, I have my bachelor's degree in criminal justice from Michigan State University.
Nice. Okay.
And so that was the framework and my basis into getting introduced to the human service field and also criminal justice.
Okay.
And then I started out as a children's protective service worker for Oakland County and got some field experience in that way. And then I really wanted to branch out and to be able to do a little bit more. And so I looked into additional continuing education, and I looked into social work. And originally, starting out in the human service field, I didn't want to be a social worker. You know, I loved the aspect of being involved with investigations, and so to me, it was really about being an investigator. But then as I looked into more continuing education, I felt, wow, you know, social work has so much more to offer, and it's just more than social work. And so then I went to Wayne State University and completed my master's degree there.
Excellent.
And, you know, I'm very proud to be a social worker now because it's so much more, and it's being able to have a wider framework and a lot more knowledge in the field, which is really dedicated to social justice.
Okay. Well, that's great. I went to Michigan, by the way, so but I won't hold that against you.
That's okay.
All right? So that's wonderful, and obviously you've decided to go because you have some desire to help the community. And where are you currently working now? Obviously, it's Oakland County. Can you give me a little bit about what you do and how you got into Oakland County and how long you've been there?
Yes, so I'm with Oakland Community Health Network, and so that was formerly Oakland County Community Mental Health Authority. Okay. And we were a part of the county, but however we split from the county in the late 90s. So we're still affiliated and we're a community partner with Oakland County, but we are separate. Now we're a public mental health system, and so we're a county agency, a part of the government, so a lot of our funding comes directly from the state, from the Department of Health and Human Services. And what we do is we provide specialty mental health services through a network of contracted providers. So we're helping individuals that may have a serious emotional disturbance or a serious mental illness. Also with individuals that may have an intellectual or developmental disability. We provide infant mental health services as well as substance recovery services as well. Okay,
that's great. I guess I didn't realize that that you weren't a county entity at this point. Obviously you're affiliated, but
yes.
So that's interesting. Your funding, you said, primarily comes from the county and state, or is it?
With the state of Michigan, the Department of Health and Human Services, and it's primarily from Medicaid funded dollars.
Okay, and when did that take effect? When did the county split off? Do you have an idea?
I believe it was in 1999.
Oh, so quite a while ago.
Yes,
okay.
Yes, and so we work very closely in regards to working with community hospitals, with the county health division, with the Oakland County Circuit Court, with the jails. We have very strong partnerships with the county entities. It's just because of funding sources and that we split apart, but we still work very closely with the community collaborators and stakeholders.
Okay. That's great. You know, working in law enforcement, I am the people that my colleagues, we deal with a lot of people who are in crisis and or may have some mental health problems. You know, a lot of times they're not diagnosed, and so as an officer, you know, we're somewhat trained in some kind of identifying these issues. You know, so for us, we see like front line about what's going on in the community. And can you speak to a little bit about the numbers? And I don't mean specifically percentages and things like that, but are you seeing like an uptick in people coming into the community health organization, or how do you think that? Are we doing okay at job with helping that population right now?
I would say yes, but I think there's always avenues to do additional outreach into the community. There's a lot of stigma around mental health concerns or issues, and we're starting to break those barriers. So Oakland Community Health Network does a lot to really encourage individuals to talk about mental health challenges and struggles and make it more normalized so that individuals are not afraid to seek treatment or help. And then also for maybe a family member, that they're more comfortable to be able to talk about it and try to encourage a family member or a loved one to get help. So I think we're doing a great job as a community working with law enforcement and our community partners, but still we can do more outreach to really help normalize the discussion, because at OCHN we really feel that mental health concerns, or whatever the diagnosis or disability, it's no different from physical health.
Sure.
And so if we normalize it, people are going to be more apt to talk about it, and more likely to access treatment and be able to continue treatment.
Yeah, I agree. I think that there is that stigma attached with mental health, and it's unfortunate because I think most people today know someone that has some kind of mental health issue, right? And so a lot of times it's not diagnosed, which is a huge problem, and people are scared to go in because they think they're going to be labeled as having some kind of severe problem that can't be helped, and then they aren't helped, and then we come in contact. And I say we, I'm talking about the law enforcement, and our hands are somewhat tied. I mean, once there's a crime, we have to do what we have to do. But a lot of times, I'm on a special unit, which is the crisis negotiation team. Okay, so we deal with people that have had issues and have not necessarily always broken the law, but are maybe they're suicidal, or maybe they are taking hostages. And so there's some serious. I've taken quite a bit of training, so I compared to our typical officers, and our command staff is very, we endorse and want our officers to go and get trained in, obviously not at your level, like we're not diagnosing and things like that, but we want to be able to go into a situation and identify what's going on and try to find the right resources. So as far as resources in the community and for the county, what is in the health system right now for people? I know we're going to talk about the youth, but let's talk about in general with, say, people who are adults at this point.
Well, they can access through our Access and Eligibility Department to see what services that are offered and that are out there in the community, so they can always contact our Access Department. However, we have a lot of crisis support, so individuals that may be facing a crisis, they can go to Common Ground, which is located on the Oakland County campus, and to get access and screening. We also have a sober support unit that is located directly at the county campus as well, at the Common Ground Crisis and Resource Center, so individuals that maybe going through some withdrawals or have some substance use disorder, they can go there, they can receive detox and then get into treatment within 24 hours, a walk-in basis, 24 hours a day. Similar to the Common Ground Crisis Center, open 24 hours a day. That also houses the RISE Center, which individuals can come in, anyone in the community. For adults, if they need assistance with housing, employment, maybe they're looking to file to get assistance or Medicaid, they can come in there. So I think sometimes it's overwhelming in a county like Oakland because there's so many resources, so it's overwhelming to how can adults or children or young adults access these services. But we do have a wide array because we work with contracted providers. So our contracted providers that work with adults include Easter Seals, CNS Healthcare, and Training and Treatment Innovations, and they have many community locations throughout the county. It's just being able to link up those individuals. So if they ever have questions, they can always contact our Access Department. There's no wrong door, so if they contact us, we're going to make sure that we connect them with the right service, even if it's something that's outside of our services. Okay.
So, when you mention like the alcohol and things like that, we know a lot of people self-medicate, and it's because they're trying, they have some issues and they're trying to numb themselves, or trying to maybe not deal with what's going on in their life. So that's definitely, I feel, a problem, and it sounds like the county, I don't mean county, but in general, the health, mental health organizations are trying to relate the two and trying to help people get through one thing and then try to focus on the fundamental reason why maybe they have that issue.
Absolutely.
And I know as far as Common Ground, that's a crisis. There's a crisis hotline at Common Ground.
Yes, there is a crisis hotline as well. So it's 24 hours. So if it's a parent or family or an adult, they can call that, a youth can call that. They also have a text line as well.
Oh, that's great.
So even be able to open up that access because many individuals are getting more comfortable with like texting, and so they're able to text that line as well.
Okay.
So whether they call in, they come in person, they can be able to receive help and crisis intervention.
Well, that's amazing that using the new technology in the world today, I think, is important. And I say new technology, I'm old, but like texting and things like that, where people don't want to call. I mean, I don't want to call half the time on my phone either. I would rather text. It's easier. Yes. So it's great that they can go online as well. Am I right?
There's a chat as well that's available.
So there's a chat as well.
Yes.
So that's really cool. Like people can actually chat, and it's somewhat anonymous, so they can maybe get their point out what's going on with them.
Yes.
And then the staff can help them get into the right door to help them. So we're going to start talking about one of the main reasons we're here today is the youth today and what's going on with kids. And there's a lot of crisis with kids. Obviously, so I'm not telling you the story. So when it comes to the children, and I say children, I'm speaking primarily minors under the age of 17. What is going on? What are you offering? What services do you have for them?
We have crisis services, so like the first and front line, and then for ongoing services, we want to link them up and working with counseling. We have peer supports, we have different groups. So there's a lot of youth-specific groups, and what's great about peer support is that there's youth peer support specialists that are able to help and mentor that youth. So a peer that has gone through and maybe has had a mental health challenge, they're able to work one-on-one with that youth, and it's because of that peer connection that it's even more successful and that individuals are able to continue treatment and be more successful with treatment. So there's a lot of different specialty services that go just beyond the counseling and the one-on-one. I mean, obviously there's psychiatry services, but there's a lot that goes into helping support youth in the community. And then working with the county as well, there's the Oakland County Youth Assistance Wing, and so however we can partner with the appropriate resources, we're going to do that front line to be able to help support youth as well as families.
That's amazing. And we're going to take a short break, and when we come back, I want to talk more about the Oakland County Youth Mobile Crisis Team. So we will take a short break and return with more West Bloomfield 911.
The West Bloomfield Police Foundation raises money to help those who protect and serve the community. Whether it's emotional or financial support, the foundation provides a helping hand to officers, their families, and those in the community. For more information on the West Bloomfield Police Foundation, contact Kurt Lawson at 248-975-8900 or visit wbpolicefoundation.org.
Hello. I'm Lisa Brown, Oakland County Clerk, Register of Deeds. You know to check your credit report, but when's the last time you checked the title to your property? Most likely your home is your biggest financial investment. And deed fraud is on the rise across the whole country. Oakland County is no exception. That's why I worked with Xerox and Google to create our Property Records Notification System. Property Records Notification alerts property owners about potentially fraudulent activity, such as forged deeds and bogus liens. This free service, which is the first of its kind in the United States, makes it possible to receive up-to-date information about a property, making it much more difficult for fraudsters to go undetected. To sign up for our free notification system, please visit ocmideeds.com.
Welcome back to West Bloomfield 911. I'm your host, Tim Shepard, and again, I'm here with Mega Szalony of the Oakland Community Health Network. And so, Megan, we've been talking about mental health and in the community and in the county. And when we left, we started getting into the youth. And I really want to get into the Oakland County Youth Mobile Crisis Team. And can you tell me what that is, how it got started, when it started, and what kind of things are going on with that?
Absolutely. So this is a new initiative, and it's led by the state of Michigan, so the Michigan Department of Health and Human Services. Now, some communities across the state already had this mobile crisis service in place, but for those that did not, the state required that we get this rolling and ready early last year. And so With our community in Oakland County, we got it started and we launched in September of 2018, and we partnered with New Oakland Family Centers to be able to provide this service. And so the clinical team and the mobile crisis team that comes out is staff from New Oakland Family Centers, and it's a part of their intensive crisis stabilization team. And that team is comprised of master's level clinicians, which are therapists, social work technicians, they have an on-call psychiatrist, and the whole team is supervised by a clinical master's therapist as well.
Well, that's really great to hear so many people coming together to try to help and make this this crisis team. As far as contacting and getting, is this a diversionary program? What's the whole thought process behind it?
Yes, the goal of the service is try to prevent youth, children, young adults from having to go into an inpatient program.
Okay.
We're trying to keep children and youth in the community when they're going through a crisis. So it's being able to provide those intensive crisis supports to the individual and family, but in the community. So in other situations, individuals to be able to seek this service had to go to an ER or had to go to Common Ground, or sometimes they have to call the police. And so what this service allows them to do is to be able to call a number, and we're not currently 24 hours, but we have a good range of operational hours from 2 p.m. to 10 p.m. So when they call this crisis line, they're reaching a master's level clinician right on the line.
That's great.
So it doesn't go through a dispatch center. They have that person on the line. They're able to discuss, and the clinician will ask what's going on in the home. Are there any safety concerns? Work through some crisis steps to see what the family has already tried to do, and then from there, the mobile team can either deploy out into the community if appropriate, or they'll provide some phone crisis intervention right over the line, and sometimes they're able to de-escalate just right over the phone call from the immediate phone call, which is great.
That is great, because I'll tell you, again, I'm a police officer, so we go on a lot of calls where things haven't reached the level of criminal activity yet, right? So, or someone that has threatened to harm themselves or kill themselves, suicidal. When it gets to that level, and we have our obligations to do certain things that are law enforcement, like petitioning and things like that. And so, but we do have a lot of instances where we come across, and it happens, can be kids, of course, right, that are going through crisis, right? They haven't reached that level. So, is this primarily? So, this is not for, obviously, if someone commits suicide or is threatening to commit suicide, that would be something that they should call the police, correct? You guys aren't.
If there's an imminent safety concern or need, then even if they do call the crisis line that's connected through Oakland County Youth Mobile Crisis Team, they will connect with law enforcement right away if an individual, if there's a current immediate, imminent safety concern. But if a parent is concerned or the individual themselves is maybe having some thoughts but doesn't have a plan and something's just been on their mind, or they've been feeling depressed or anxious, it can be any situation. They can call this line and then they can get that immediate support.
Okay, that's wonderful. Because again, like I said, we come across a lot of situations where it hasn't met that threshold where we need to take someone and get help for them. So it's, I think for law enforcement, myself, it's going to be a wonderful tool for us to be able to go out and offer this to the people. Now, so in terms of payment, how is this is funded through the state?
Yes.
Okay. Can you elaborate a little bit?
Yes, so for individuals that want the mobile deployment and are requesting the mobile deployment, currently at this time it is a Medicaid funded service, and so individuals, it's a service for anyone 0 to 21 years of age, so it does also capture that young adult population, but they have to have Medicaid or Medicaid plan, or be presumed Medicaid eligible, or be uninsured as well. So for the individuals that are uninsured, they can also access this service. And that's due to our funding. And we currently didn't receive additional funding from the state to be able to provide this service. There's always discussion about how we could receive more funding so that we could really open it up to the whole community, because that would make it a low barrier, accessible to everyone. However, currently at this time, it's just we have those eligibility requirements, but we would like to open it up in the future, pending additional funding that we receive.
Well, okay, so let me ask you this. As a law enforcement officer, I don't ask people if they have insurance. So if I go to a home and somebody, and you said zero, it's from 1 to 21, obviously
Yes.
not 1-year-old, but
Yes.
from a very small child up to 21.
Yes.
So that's a wide range. And so if I go to a location or a family doesn't know about how to pay for this, is there a way for us to contact you? Because like I said, I don't go and ask people if they have insurance or if they have Medicaid. That's not something that's in my in details of my job.
Yes.
So how is that handled?
We always want the families just to have the information and
Okay.
individuals in the community to have the information, because even if they're not sure, we want them to still call, because what's great about working with New Oakland Family Centers is that they provide a lot of behavioral health services outside of this mobile crisis support. So even if the individual doesn't have Medicaid, they can still call. The mobile team may not be able to go out. However, they can always say, as long as the child or individual is able to remain safely in the home, they can say, what if we schedule an intake tomorrow morning at one of our locations? Would that be an option for the family? So even if the mobile team isn't able to go out, they're still able to provide support by talking to the clinician over the phone from New Oakland Family Centers. And they can always arrange for the most appropriate support, because whatever the situation's going on, regardless of insurance, they're going to want to provide support for that family in that immediate need. So they're never going to turn anyone away and say, we can't help you. The mobile team may not be able to go out. However, they will provide that support over the phone and connect them with support, whether it's through their own agency or if it's through another agency in the community.
So, essentially, if someone is feeling like they're hopeless, and I'm talking about typically a parent or someone that's in charge of a minor or a young adult, there's a way to triage and try to figure out how to get help for their family. And again, I think that that's a huge issue in our society, right? Because obviously funding dollars are hard for everybody, including law enforcement, mental health, the health system in general. There's a lot of challenges to provide these services. And as far as the services, you said how long have you been with
Oakland Community Health Network? 3 years.
3 years, okay.
Yes.
And so again, do you feel like this initiative that's been going on since 2018. And what month, do you remember?
September.
September. So, so almost a year coming up pretty soon. Have you seen people using this service?
Yes, now that more people are becoming familiar with it and the information is getting out to families, we're really trying to work through our community partners, through the courts, through our local law enforcement agencies, through our community partners to really get out the information. It has really been ramping up since December. Also partnering with our local hospitals and emergency rooms. They're also contacting them, so social work departments for the hospitals will call and ask for assistance. And so the team goes out and provides the crisis intervention and assessment also at the hospital, similarly to if they were to go out to an individual's home.
Oh, they actually would go to the hospital as well. Okay.
Yes, and it's great because this the mobile team from New Oakland can go out to homes, they can go out to foster care homes, they can go out to schools, college campuses for that young adult community, practically everywhere in the community. Now there are some few excluded locations, per the state.
Sure.
They can't go to detention centers, so they're not able to go to Children's Village of Oakland County. They can't go to residential centers or licensed child caring institutions, and the jail as well, since that 18 to 21. Should something occur, they're not able to go there as well. But everywhere else in the community, they're able to go to, so it's really accessible. It's a mobile, support. It's community-based, so wherever an individual is in crisis. Another great part is if they do deploy and the team goes out into the community, they have 60 minutes to get to the family and youth or individual in crisis. So in Oakland County, they have to meet that 1 hour time frame. New Oakland's been very successful in doing so, and so we're really excited to see that. And parents and individuals are accessing this service, and so it has been really important and beneficial, not only to divert from hospitalizations, but also from criminal or juvenile diversions as well when appropriate.
Okay, that's wonderful. So we're going to wrap it up here, but I'm wondering, is there a phone number that you can, what we'll do is I'll ask and have the phone number put on the screen for us so people can get that out. I think it's important we get that information out. But you sound very passionate about your work, and I think that someone that goes into a civil service field, regardless of what it is, law enforcement, mental health, needs to be passionate about what they do. So, we're lucky to have you helping the community that needs you, and this service sounds wonderful. And as a police department, we're definitely going to promote this and try to use the resources that you've brought for me today. So, thank you very much for coming in, and I just want to thank everyone for joining us for this episode of West Bloomfield 911. You can keep up with the police department by liking us on Facebook, following us on Twitter and Instagram. You can also sign up for Nixle.com and CrimeMapping.com for the most up-to-date information on the police department. Thank you for watching. Take care.